Good afternoon, everyone. I'm Dr. Gautam Banga, reconstructive urologist, specialist in urethral penile surgery, SA International Hospital, New Delhi. So today, in this beautiful afternoon, I'm going to discuss about hypospadias, which is one of the most common congenital deformity in male child. So, what is hypospadias? Hypospadias is a deformity of external genitalia of a male child, in which the penis is bent, which is known as a body. The opening of the urine pipe or the urinary meatus is not at a normal position, that is at the tip of the penis. The skin is distributed irregularly in spite of distributed all around. And along with the hypospadias, the child can have absent of testes or undescended testes, or the scrotum is not well formed, or it's divided in the middle, which is known as bifid scrotum. So hypospadias is not a single entity; it's like a multiple deformities which are all together. And once we plan for a hypospadias repair, we have to take care of all the aspects of the hypospadias, not just the urine pipe. Well, the major concern of the child is always, or the parents, are always the urine flow, or the urine direction of the urine flow, which according to the patient's attendant or the parents is downward. But when we go for the surgery, or when we think of repair of the hypospadias, we have to give the penis a good shape, a good cosmesis. We have to cover it up completely with proper skin, and we have to make it straight. We have to have the urinary opening, a new urinary opening at the tip. So there are various questions which we come across when we see patients of hypospadias, and most of the time this question are from the parents because the kids are small. And the first question comes to their mind, at least in Indian scenario, is that whether the patient will be able to have a normal sexual life and whether he will be able to father a child. So there are a lot of myths around hypospadia that it affects the sexuality, it affects the sexual ability of the male child when he'll grow up, when he become adolescent or adult. So I just want to clarify that hypospadias though leads to curvature of the penis, and when we correct it, once the penis becomes straight, the patient can have a normal penile length in most of the cases, and the patient can have a normal sexual life in future. So that thing should not be too much worried about. Yes, if it's a very severe kind of hypospadia, the penile length can get affected, but in most distal hypospadias or mid-penile hypospadias, the curvature, once corrected, the patient can have a normal sexual life. And the second question most of the patients attendant ask is, what is the right time to go for the surgery? So the best time to go for the surgery is when the kid is 1.5 years to 2 years old. Because at the time it's easy to manage the child has not yet started going to the school, and even from the anesthesia point of view, it's safe. The child is on 1.5 years or 2 years old, then we can easily go for a surgery. Now the second question most of the patient asks is whether we require a single surgery or multiple surgeries. Well, in most of the cases, if the hypospadias is mid-penile or above, that is distally to mid-penile, in most of the cases, the surgery can be done in single stage with correction of all the aspects, whether it's skin, whether it's urine pipe, or the curvature of the penis. Everything can be corrected in one surgery. But in cases in which the urinary opening is very low, or can say at the base of the penis or at the level of the scrotum, with severe curvature, in those cases, sometimes when we correct the curvature, we have to divide the urethral plate, that is the thing which is which form a plate kind of thing between the urethral opening to the tip of the penis. If that is the cause of the curvature, then sometimes we have to remove that plate, and in those cases, we have to go for two-stage repair. In which first stage we correct the curvature of the penis, that is we make the penis straight, and in the second stage, which is 6 to 8 months after the first stage, we go ahead with the formation of the urine pipe and formation of the glans, that is the tip of the penis. So in 10 to 15% of patients, the main complication which we encounter is fistula formation. That is a small opening formed at the in the tube of the urine tube which we form. And fistula, in most of the cases, can be closed after 6 to 8 months of the repair with a simple procedure. And so the success rate of hypospadias repair varies between 85 to 90% for the single stage, and around 80 to 85% for two-stage repair. Now the second question is almost not the second one of the most common question asked by parents is that whether the patient will be able to father a child. So I always tell the parents that fertility or the ability to father a child does not depend upon the hypospadias or its correction, but it decided by the testis and its location. So in the patient who have either absent testis or undescended testis with the hypospadias, we always go with the correction of the undescended testis, unilateral undescended testis with distal penile hypospadias. So we do both the procedure together, that is orthopexy, bringing the testis down and creating the normal urine pipe or hypospadias correction. But in cases where the hypospadias is very much proximal, like the proximal penile at the base of the penis or at scrotal level with undescended testis, in this patient we have to evaluate for sexual discrepancy, that whether the patient have a normal male child or it's actually a hormonal disbalance which are due to dysenergy of sexual differentiation. So in those cases, we have to go for chromosomal analysis and ultrasound to look for female organs. And if those things are found, if it's a patient is having 46XX, that is the female composition of chromosome, then we have to counsel the patient accordingly and we have to treat them on those treatment lines, on those treatment protocols. And hypospadias, one more important thing which we see nowadays are the failed hypospadias coming to our clinic for the treatment. These are the adult or adolescent which have been operated say 10 or 11 years or 12 years back, and now they come up with various you can say side effect of the previous surgeries. So most of them are adult, and now they are on the verge of starting their sexual life and they're trying to get married. And then they realize that there's something wrong with the penis, that the previous surgery had not given them the right results which they wanted or which should have been given. So in those cases, we have to do a complete evaluation. We have to see all the compartments of hypospadias issue, whether the penis is straight, whether the skin is sufficient, or whether the urine opening is at the tip and of normal caliber. So most of the patient with failed hypospadias have a failure of either one of the component or all the components are involved. So in those cases, we define protocol or we define treatment on an individual basis, and treatment is done. So the results of adult hypospadias repair at our center is more than 85%, and afterward they are living their sexual life in a normal way, and many of them have father-child, and they have a good married life. So hypospadias repair, I want to again clarify that there is no correlation between erectile dysfunction and hypospadias repair, or infertility and hypospadias repair. So even if you are an adult and you have hypospadias deformity which has not been corrected in the childhood, or whether it has been operated upon but the results are not as you expected or not as per desired, then you can always consult a reconstructive urologist, and this kind of problem can easily be sorted out, and this problem can be corrected surgically. So,
Dr. Gautam, can we have some questions? Like, I keep getting questions that what could be the maximum age limit one can go for the hypospadias surgery?
Yeah, so very good question. There is no defined limit. We can always define the lower limit. So the lower limit is that the child should be operated, say around 1.5 years, 18 months. They should be operated, but there is no maximum limit of surgery. I have operated that male of 42 years and 47 years because they wanted a good penis, good penile length, and they were having a lot of curvature of the penis because of the hypospadias. And though they were sexually active, but they wanted the penis to be straight and more cosmetically appealing. So they have gone for the surgery at the age from 42. So there is no restriction of the age. Even if you are an adult, if you are adolescent, if you have hypospadias, you can go for surgery right now.
Oh, that's great thing. One can go for the hypospadias surgery till the age of 50 years.
Yes, that's true. That's very true.
Yes. Okay. So there's one more question which I came to mind. Suppose if I had a hypospadias surgery, will my children will have the same problem? Can it be? Does it pass through the genes?
So there are various syndromes in which hypospadias is one of the components, and it is genetic syndrome. But in most of the cases, it's an isolated deformity. The genetic syndrome are very rare, but yes, if there's always a chance of passing on the genetics component. So there's always a probability that if the parent is, if the father is having hypospadias, there is a very minimum, like a mild percentage chance that the son can have that kind of deformity.
Okay. And sir, after surgery, how long does it take place to heal the wound?
Yeah. So we at our center, it's like 1 day surgery. We keep the patient for 24 hours in the hospital because we do all these kind of surgeries under anesthesia. So hypospadias child is discharged after 24 hours on the next morning with a dressing on. And in most of the cases, we do urinary diversion in the form of suprapubic cystostomy, which is known as SPC. So the child doesn't wet the dressing, or there's no pipe which is coming out of the penis and getting attached with the urine bag. We keep a small stent, which is not very much troublesome, and we normally call the child or the patient for follow-up on day 7 or 8 for the first dressing. And then they have to come on day 11 and day 15 for the dressing. On day 15th, we normally remove the stent and we clamp the SPC tube and we let the patient void from the newly formed urethra or the urine pipe.
Okay, that's sir. What happens? Some patient comes to our clinic, our hospital, and then they say, what could be the complications after the surgery? So this is one of the most questions which I keep getting.
So as I said, look, whenever we do a surgical procedure, there is always some minimum incidence of say around 0.5% of infection rate, which is almost say like universal. We are trying to bring it down. We have already bring it down to less than 0.01%. And on the other complication, as I mentioned, the post-surgery, the patient can have bleeding from the wound, the patient can have swelling around the penis, the patient can have stent coming out. So though these are the known complication, but the chances, the incidence of these complications are very rare.
Okay.
And you can say the most common complication in post-surgery is the fistula formation, which I said is in the range of around 10 to 12%
okay.
in a patient. And but in most of the patients, it can be treated in a comfortable way after 6 months or 4 to 6 months of the surgery.
Okay, great. Sir, like see, we are in India and we have so many types of treatment here, like yoga. Then alternative medicine, and then some like Unani, then homeopathy. So I just wanted to know that if someone does not want to go for the surgery, can it be treated with the alternative medicine? Is it possible?
I say a big no for that, because this is a genetic deformity. It's a structural deformity. So a structural deformity of the body need to be corrected by a surgery. All the aspect of hypospadias should be corrected, not just one aspect of just creating the urine pipe at the tip, but the penis should be made straight. The skin should be distributed properly in a cosmetic manner, and the urine pipe opening should be brought at the tip. and there is no other modality of treatment but the surgery. So my advice is that if you have a hypospadic child, or if you know somebody who have a hypospadias, please advise them to consult a reconstructive urologist and go ahead with the surgery, because there is no alternate method of treatment.
So surgery is the only mode of treatment.
Very true. Very true.
Okay. Okay. So I have one more question. Like if some parents know that my child has hypospadias problem, so they want to know that what anesthesia is used, and is it safe for their baby?
So I always advise my patient to, or whenever I go for a talk, I always tell the patient to get themselves operated at a center which is well equipped. You should have a facility to take care of pediatric patients, should have a pediatrician on board, and the OT should have all the equipments, all the you can say infection control measures to go ahead with these kind of surgery. Because there's one line which I always tell the patient that for me this is one surgery, for you this is one surgery in lifetime.
Yes.
So you should not compromise on the standards of the care. You should never compromise on the skill of the doctor, and you should always search. You should always find out who's the best doctor, best reconstructive urologist available around you, and you should consult them and go for the surgery. The anesthesia which we gave is general anesthesia, and in a center like ours, which is a tertiary care center, we have full-time, well-versed, trained anesthetist with the good OT technician and post-op recovery and ICU care. So the patient satisfaction rate is high, and always believe is the hospital and the team which is more important and more contributing than just the skill of the doctor. So in together as a team effort, we can actually achieve the results.
Okay, so that's great. Okay.
So again, coming to the topic of hypospadias. So as I said, that hypospadias surgery is a safe surgery, and if the doctor is trained in that subspecialty, has been doing good number of reconstructive procedure in the form of hypospadias repair, then you should is the right person to be approached for the surgery. And you have to just check how the results of that institute or the center, and then you can plan the surgery fit.
Okay, sir. So I'm getting one question. The person is saying that after surgery, can you perform the normal sexual life?
Yeah. So once the stent is out, so after a week time of removal of the stent, the patient can go ahead with the normal sexual activity. The only thing which we have to look for is that there should not be any raw area on the penis. There should not be any infection, and we always advise the adult who have gone through the hypospadias repair to use condom for the initial few days or say weeks to get any infection on the operated site. But normally a patient who has gone hypospadias can resume his sexual activity say after a month time of getting the things done.
Okay, that's great, sir. So it has a wonderful session. Thank you, Dr. Gautam, for such a great session on hypospadias surgery. Thank you, sir.